Welcome to The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me is my co-author and business partner of 2x2 Health, Wendy Benson. While we are all impacted when we have a healthcare crisis, children experience healthcare issues differently, and so do their parents. If you've ever had to take your child to a specialist for a test or surgery, you know firsthand how scary and oftentimes confusing it can be. So we thought now is a perfect time to help provide some clarity for parents and grandparents who have little loved ones in their lives. Joining us today is Dr. Sri Pillai. Dr. Pillai is the Division Chief of Pediatric Surgery at Rush University Medical Center and Associate Professor of the Department of Surgery at Rush Medical College. Wendy and Sri, welcome, and I'll let you take it from here.
Thanks so much, Beth. And Dr. Pillai, we are so glad to have you. Thank you so much for joining us.
Absolutely.
So, surgery at any age can be, a really frightening thing. And when we think about surgery for the pediatric population, for kids, it could be even more anxiety provoking. How do you help parents kind of prepare their children for an upcoming surgery or surgical procedure?
So in actuality, I think there's a few things that we do. One thing is that children are already anxious about a lot of things, new environments. Going to the doctor's office already is an anxiety evoking type of a experience for a kid. So if you're thinking about surgery for a kid, it's even worse. So a lot of times we try, number one, to try to explain the operation in a little bit more of a simpler sense. If they need an operation for a mass to be removed or other things, we'll talk to them about, hey, this lump that you have, we have to, we'll try to take this out to make you feel better. We tell them that we try to explain a little bit more about the process of what they're going to do when they come in. I think a lot of things that happen with kids, and it makes it a little bit of an easier experience with them, is the expectation of what's going to happen, and then the actual realization that their expectation is actually being met. A big part of it is also getting all the questions answered. And I think for the families, I think that's the more important part of it, is that, they don't really know a lot of times to ask or what to ask when they're in for their appointment when you're talking about an operation. So we try to have, if it's a common operation, we'll have some sort of pamphlets or some information available for them. I always give them my cell phone number so they can always call me when they get home and they want to talk about it or they want to get more information. It's a lot easier that way. So those are a few things we try to do to try to get them ready.
And I have to say, the patients that we've worked with you on, giving the parents your cell phone number has really been a big hit, and it has really put people at ease, knowing that when they go home and they have questions, that they can give you a call and they're not going to lose any sleep over. So thank you for doing that.
And it's interesting because you'll talk to people and you'd say, yeah, I just give my phone number. And they're like, oh my God, you're giving them the phone number. You're going to get all these calls and these people are going to be calling you day and night. That doesn't happen. I think it's more of, like you said, it's like a safety kind of a blanket or more of a security thing that, well, if I have a problem and I need to talk to somebody and I am really concerned, I can reach out to the surgeon directly and I trust that. And I think it builds a little bit more trust in the situation because, if you know who you're going to call and you can directly reach the person who's going to be doing the operation who has done the operation on your child, and at least you know that, okay, I feel better knowing that I can pick up the phone and call or text or do whatever I need to do, and I'll get the information right away. So, and I always tell families that it may take me a little time to get back to you, but I'll answer you back, I promise. So.
Yeah, no, you're great at it.
Well, I just think that's so reassuring for the family to know that if things get into a really uncomfortable, really tough situation, that they know that they have a direct line. I mean, I think that that's so important, that accessibility. And to your point, it sounds like people haven't abused that accessibility. No, it's done nothing just but make them feel more comfortable and reassured.
And I think the other thing too is it gives me a little bit more of an inline to the patients too. And honestly, randomly, I may call a patient's family up that I haven't seen in a month and say, hey, how's it going? What's going on? Just checking in, seeing out what's going on. So that's, I kind of keep in contact with some of the families as well that way too. So it's a two-way street. The other thing is that it does keep the kids out of the ERs and in the urgent cares a little bit more, because if a family doesn't know what to do with the situation, if they call their pediatrician, or if they, if it's after hours and they can't reach anybody, then, they'll go to the emergency room, and then they'll spend 2 or 3 hours there waiting, so, it's, if they call me and I'm like, oh, well, if everything's okay, why don't you come by and see us in clinic tomorrow? Why don't you call us up in the morning? We'll fit you in the afternoon. Then it saves them a trip. It saves them that hassle. It's just, it makes it a little bit more efficient for them too.
Absolutely. Less tasks, unnecessary tasks. I mean, it just really speeds up the whole process.
Yeah, I agree.
Yeah.
So I like how you talked about the preparation beforehand, because I think for all of us, sometimes the unknown is just even more stressful than knowing what to expect at any age, right? And then how do you help prepare the parents and the children for the recovery phase? Like I remember when we talked about with you and when we were writing our book, The Confident Patient, talking about how like sometimes pictures help, and sometimes knowing in advance, then it's not as hard to deal with the recovery because they know what to expect. Can you tell us a little bit more about that?
Yeah, so a lot of the operations, if they're complex operations, we'll draw it out and illustrate it, or I'll show them pictures to show them what we're going to do. And as far as the recovery, a lot of times we'll make a little mark on the skin and say, well, this is as big as it's going to get. This is as big as an incision you're going to have. So they know they know when they see it, oh, this is it. The other things I do for the recovery is, depending on and I talk to the family a little bit about this, because there's some kids that have a high pain tolerance. There's some kids that, they recover relatively fast. There are other kids that are a little bit more sensitive when they have, procedures, or they may be a little more sensitive to pain. And I get an idea from the parents how their kids are, if they've had any other previous operations or procedures before, even like at the dentist office or anything like that, and how did they do after that? And that gives me an idea a little bit about how they'll recover from surgery. I always tell them that I rarely use narcotics post-op. If it's a bigger operation, I do provide that, but I always tell families that, do the non-narcotic stuff first for pain control. And if you need it, definitely it's there.
Absolutely. So over the last couple of months, obviously, we're in the middle of a global pandemic, and pretty much every aspect of most of our lives has significantly changed. Doing what you do as a pediatric surgeon, how have things changed in the world of pediatric surgery with everything that's going on from a healthcare perspective?
So it's been interesting, because I think that, initially when this epidemic started, we were in shutdown phase. So really, we weren't doing any elective cases. We're only doing emergency cases. And what we found out was, even the emergency cases, people were coming in very delayed with their diagnosis. So an appendicitis, a child with belly pain that we would have normally caught early with appendicitis, is coming in 5 or 6 days or 7 days later, and they already had a perforation. They've already had a significant amount of adhesions and scar tissue in the abdomen, and the surgery is much more difficult at times. But, you're going to see that with all of these patients, adults and kids, that when they're concerned about coming into a hospital, coming into a doctor's office, they hear everything on the news about, COVID is everywhere. You have to be careful. It's, the hospitals are full of these patients. And honestly, from what I've seen so far in just the communities, the hospitals are actually the safest place to go in some ways. Everybody's wearing a mask. Everybody's washing their hands. Everybody's doing proper social distancing. Everybody's taking care of that. So that's the least dangerous place to be if you need to be somewhere. A lot of the surgeries that we do that are elective surgeries, we have put off when this was going on. We have gotten back to normal, the kids are a little bit more, and the parents are a little bit more or less apprehensive about coming in now. We try to do virtual visits and use telemedicine as much as possible if we can. A lot of the post-op visits or a lot of the patients that just require just, routine follow-ups that we don't really require them to be in face-to-face. We try to do virtual visits or at least offer them so the patients have that opportunity to say, I want to come in or I don't want to come in.
When patients are at rush after surgery, are parents allowed to be with the patient, their child, after surgery?
That is a moving target. I think that at rush, I think that the parents are with the child pre-op, but only one parent can be there. I do see the parents in the waiting room during the surgery or right afterwards. So there's one parent in the waiting room. A lot of times dad or mom or one of them is in the car or they switch out. Mm-hmm. But when they come out of surgery, there's always one parent that can come back and see them. In the recovery room, they do keep it limited sometimes. So they may not be able to get to see their child until after they get to the floor in some cases.
So speaking of moving targets, one of the things that is being talked about a lot right now is schools for our kids and, what to expect with all of that. I would think that both personally and professionally, a lot of people are asking you your opinion in terms of what your thoughts are in terms of what school is going to look like this fall and what we should all be prepared for.
That is definitely a hot topic, and it is a moving target because nobody knows what's going to happen. And a couple of things that I tell families are that one, this virus can affect anyone. It's not, they can say it usually affects elderly people, comorbid factors, other health problems, but there's young people, there's kids, there's other people that do get this virus and they can get severely ill from it. So you can't predict who's going to get ill. That's the problem. Number two is you can't predict the symptoms. It could be the cough and the fever and all of the upper respiratory tract issues, or it could be a GI issue, or it could be some rash, or it could be something else, or it could be asymptomatic. So you don't even know what the actual symptoms are going to be to look out for. And they mirror a lot of the other viruses that are in the community as well. I always tell families that there's two things. One is what your comfort level is going to be when your kids go to school and what your comfort level is going to be with, the environment. And the second thing is what your reality is going to be in terms of work and what you need to do. When the COVID crisis first hit and we went into shelter in and lockdown, a lot of people were working from home. A lot of people were furloughed, or a lot of people could take that opportunity to stay with their kids. Now, even if we go to phase 3 or if we downshift again, families, if you have two parents at work, they're still going to be required to go to work. But now you don't have somebody taking care of your kids. And if something happens at school, when they do get quarantined or they do have to stay at home or they do downshift into phase 3 and say that we have to go all virtual, there's really not a lot of options for a lot of families that, what do you do? Because you don't have the help or the child support or anything else. So a lot of times I tell the families, look, if you can get a group of kids together that are similar age, that their families and what's going on, and you can do more of a pod type of approach to the virtual where, maybe all 4 kids are at one house for one day, and then the next day they're at a different house and they do their work there. And that way they can socialize a little bit, but at the same time, you're limiting their contact with everything. And the families, that may be an easier way of doing virtual than, just relying on mom and dad to try to teach like world geography or something, which never works. And, it's not our skill set. We can't do it. We know we can't. But, this way, at least you can have, you can at least rotate. So you're only dealing with your kids one day out of that 5 days. So somebody else has to deal with it the next day. So nobody gets overly stressed out about it. The other thing is there's a lot of teachers and retired teachers that have already, finished their jobs and they retired. And I often tell them, look, if you really want that, and if you want to continue virtual, then the other option is you can pull together and hire somebody to actually be there as a teacher and to actually go through the assignments and everything with the kids. And that way they have almost like a homeschool / virtual learning experience, but the parents aren't involved. You have an actual professional doing it. But, for one family to do that, that's a pretty pricey thing. But if you get, 5, 6 kids together in the same age, then that's not a bad option either.
Yeah, those are great ideas. I haven't thought about any of that. Those are great ideas. Thank you.
Sure.
So are there any other thoughts that you'd like to share with us?
I think, it's a tough time, guys. It's a tough time for patients, tough time for physicians, all of the providers, nurses. It's a really tough time, and it's an unknown. I think that the key thing right now is you're going to be in this for the next 6 months. So batten down, make the decisions, and we're going to be in this for 6 months. 6 months is not enough to completely, disrupt a child's social behavior, development, or anything like that. They'll catch back up. I mean, they're very resilient. If this was going to go on for 3 or 4 years, that's something different. But I think within the next 6 months, January, February, after this first half of the year is over, I think that there should be some treatment, some vaccines, some therapy that's available to kind of downplay the severity of the disease. So I think this next 6 months is going to be the hard time. And I think by the second half of this year, or the first half of next year, actually, I think we'll be in a better shape, and the kids that are home might be able to go back to school now.
All right. Thank you again to Dr. Sri Pillai, Division Chief of Pediatric Surgery at Rush Medical College. If you would like to contact him, his email is srikumar_pillai@rush.edu. Stay connected to us through our own Facebook page as Wendy and I continue our conversations with medical experts as we help the confident patient in a new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.
Thanks, guys.
Thank you.